Good afternoon, everyone, and welcome to Let the Adventure Begin. It is the first episode of an 8-part pregnancy series where we're creating a bit of a community for our pregnant neighbors and our caregivers in our Women's and Children's Health Department here at ChristianaCare. A little bit of a backstory, you probably can't tell from the Zoom framing here, but I am also pregnant, joining the pregnancy community here at ChristianaCare, so we thought this was a great opportunity to talk to all of you about what we're offering and to our pregnant caregivers and our pregnant neighbors, and all of the different things we'll be able to talk about over the next 8 episodes that'll run us about until November. So today we've brought in Dr. Matt Hoffman. He is the Endowed Chair of Obstetrics and Gynecology here at ChristianaCare. Dr. Hoffman, thank you so much for joining us today. Please take a minute to introduce yourself.
Yeah, so thank you, Megan. I'm Matt Hoffman. I'm the current chair of Obstetrics and Gynecology at Christiana. I've been caring for this community for 26 years. You asked me to do the math. I've delivered a little over 7,000 babies, including my residency before that. Very much focused on how do we care for our community. Interested in thinking about new ways to care for people. Very active in research, mostly focused on prematurity, both nationally and internationally. So I'm happy to share with what we're doing in our community and hope to answer some questions that may be out there.
Absolutely. So for those who have never met Dr. Hoffman before, he is the head of OB here at the Center for Women's and Children's Health, which means he'll be able to answer all of the questions today. So if you have any questions, please leave them in the comments below. And just a little bit of a preview of what's to come. It is breastfeeding month, so we will at the end of August be doing an episode on breastfeeding. We'll be doing an episode on eating for pregnancy, an episode on what to pack in your hospital bag as you get closer to giving birth, and any topics that you specifically want to hear about. So if you have topics that you're specifically interested in, topics that you have questions on, that you think could also be an entire episode, an entire half hour here on Facebook Live, please leave those in the comments below as well. We would love to hear from you, and we want to hear about what you want to talk about. So, Dr. Hoffman, let's start big picture. There are a few great practices here within our community for our OBGYN patients. Highlight a little bit of that.
Yeah, so just to say, we continue to invest in our community and reach out to our community in different ways. So we have opened up a number of new practices and also integrated with a number of different practitioners that have been part of our community for many years. Some of our newer practices, we have a new practice at Middletown East, which is located above the freestanding emergency department. We've now extended into Kennett Square. We have a super large facility now on Concord in 202. We similarly have integrated Dr. Cooksey, who has been providing care for 26 years within our community, as well as Dr. Gordon in northern Wilmington from that perspective. So we continue to grow to better serve to our community and provide new access points for obstetrical care. Just also point out, I think it's worth mentioning, we've had a little growth on campus as well. For those of you who don't know, we have stood up the new Women's Tower, which is a new 8-story tower, and we hope to have a virtual tour to you coming in the coming months.
Absolutely. So let's talk a little bit more about that building. So you and I have been on live before to talk about the building, but unfortunately with COVID and the fact that it's only been around for about a year and change, many women, even if they have toddlers, have yet to experience this building. So give us a little bit of a preview until that tour comes out or women are able to experience it for themselves.
Yeah, so certainly a true investment in trying to care for mothers and babies better. So it's not just about bricks and mortars, but also about processes to reflect on that. On the first floor, we have expanded our women's emergency room, which is a critical access point for many women with all private rooms, and that allows us with more access and more privacy for families. We've extended a family space where we're hoping to start to open up and have more community events where we can not just be with Facebook Live and other venues, but to actually have people come into our venue. We'll have a gift shop that will be opening up certainly, and hopefully in September to better serve some of those needs for our particular group of patients. On the second floor, we have a new high-risk area as well as antepartum ward, What's really nice about that is we have a children's garden. So many of our patients are with us for long periods of time. The opportunity to have family there, as well as a community space for those folks to celebrate holidays, events, etc. from that perspective. The third and fourth floor are NICU. So about 8% of our moms will require some level of special care, often for short periods of time. And rather than separating mom and baby, we have the ability to now do what's called couplet care. It's a European model. Not many centers in the United States have it, but basically mom has the adjoining room next to the baby. So it's a chance not to be separated from your baby, but to be right there 24 hours by 7, but also the opportunity to separate for those times that people need a little bit of space. Moving up to our postpartum, spectacular views on floor 6 and 7, all private rooms. Again, lots of community space with the idea that the community is really central to what we do.
Fantastic. So this episode is called, You're Pregnant, Now What? So why don't we start at the beginning? That first appointment after you've chosen which OB you'd like to see, you've chosen which one of our practices you'd like to attend. What can someone expect in that first appointment?
Yeah, so the first visit is really kind of coming to understand who you are and sort of laying out a roadmap and providing some of the education. So there are a lot of events within the pregnancy and the prenatal course that first visit sort of sets the capstone of where will need to be done in sort of discussing risks and opportunities to do better and improve the health of the pregnancy. So typically the visit is talking about medical risk, any particular challenges that folks may have had in prior obstetrical visits, prior pregnancies, and then coming up with a plan. Often involves a physical exam, and typically in our practices, an assessment to see how long you are in terms of you're pregnant, in terms of doing an ultrasound. Increasingly, there are a couple things that have sort of shifted. So genetics has changed a lot. So routinely, we are now offering something called NIPT or free fetal DNA. This is a blood test that very accurately tells what the risk of having a baby with Down syndrome or some other common genetic issues, and that's an important conversation for most parents. That test can be done as early as 8 weeks. So the counseling has very much changed from where it was even a few years ago. Our ability to detect genetic anomalies within mom or carrier status has also changed. So there's a lot of focus about that. And then there's a lot of just early education. What can you expect? So when you become pregnant, pregnancy touches not just the uterus, but every cell in your body. There are a lot of changes and opportunities to kind of express with what you desire, but also the changes that are going to happen naturally is just simply being pregnant.
And that appointment also comes with a lot of potential lifestyle questions. I know one of my main questions was, what can I actually eat and what should I stay away from? So what are kind of the hot things in that category right now?
Yeah, so there is no greater lifestyle change than becoming a mom or adding to your family. Lots of folks take it as a opportunity to sort of think through some of those choices. The reality is for most folks, doing what they're doing is perfectly appropriate. It's an opportunity to talk about nutrition, an opportunity to improve what you're eating, to set kind of goals of what sort of pregnancy weight we're hoping that folks achieve. It's also an opportunity to talk about exercise. So people think that they need to change dramatically in terms of exercise. We've actually pivoted, and we know that, in fact, moms who exercise regularly have lower risk of gestational diabetes, a common complication, are less likely to have a cesarean delivery. So those are important things to kind of begin the conversation. I will say about exercise, changing the types of exercise that people do is an important thing. It's not unclear to folks that, in fact, your center of gravity is about to shift from one spot to a very different spot. Pregnancy has a lot of interesting hormones, one of which is it starts to open up the joints. And as a whole result of that, folks are a little less graceful as they may be. So the person who's used to running may choose to go to walking, but we still strongly encourage folks to exercise.
And what about, prenatal vitamins and other medications that we either should or should not be taking?
Yeah, so I think the starting point about prenatal vitamins ideally is in the planning phase. So we know that if we can start folks several months ahead of time, that's ideal. So when we talk about prenatal vitamins, there are sort of three major components to it. There's folic acid, and that has been shown to prevent certain types of birth defects, particularly spina bifida. And we know if we start that earlier, that those risk of those particular birth defects is lower. The other component about it is the other general vitamins. Those are helpful, particularly iron. We know that about 20% of women will become iron deficient. And it's an important thing to pay attention to. Iron is probably particularly important in the last part of pregnancy. It's been shown to help with some neural development issues in terms of children. So getting the start of getting the iron stores up ahead of time is an important consideration as well. The last part is DHA or fish oil. So there's been some pretty convincing evidence that helps with some, again, neural development of babies, particularly the way that they see and interact with the world. So we encourage moms to think about a prenatal vitamin that has DHA or fish oil as part of it. The other part of it is some of the challenges with first parts of pregnancy. So nausea and vomiting, morning sickness is well known. So how you get your vitamins, there's lots of little tips and tricks. Some of those may be thinking about timing of when you take your vitamins, taking your vitamins after you eat. The other part of that, there are a lot of interesting opportunities. There are gummies, there are lollipops. So there are lots of ways to get your vitamins from that perspective.
Great, thank you. And one of the perks of being a ChristianaCare patient specifically is the app, the Pregnancy Care Coach app that I know you and your team have worked very hard on over the past few years. I can share I'm 23 weeks today. My baby is the size of an eggplant, which I love checking in every week. So give me a little preview for those who maybe haven't downloaded the app, or maybe those who are using the app but might not know all of what it has to offer.
Yeah, so part of thinking about taking care of patients differently is we looked at what folks were doing, and we know that about 2/3 of moms download an app. When you look at the app market, what we find is there's a lot of commercial drivers of people selling apps, selling products, selling information, or having them purchased. And when you drill down a little bit further, only about 7% of the apps that are available actually have all the things that people need to manage the pregnancy. The other part of it is we recognize that our community is unique. There are a lot of resources that folks need to care for themselves in their pregnancy. So we wanted to give them an opportunity for one-stop shopping. So we have built in things like who are the obstetricians within our community, where are the pharmacies, which pharmacies are open at 2 in the morning when you need to get a prescription filled emergently. We also have maternal fetal medicine, as well as the pediatrics, as well as a lot of other great resources within Delaware. So, lots of folks need guidance through a very complex system. This is really designed to kind of meet all of those needs. The other part of it is that we partnered with a group called Unite Delaware, and they have a whole group of 77 services throughout the state. That if folks have unique needs that they can reach out to, as well as the common information you would find in most apps in terms of body changes, what to expect, how to do your fetal kick counts, how to follow your diabetes, your blood pressure, if those things are indicated.
And I know another piece of information you can find on the app is all of the ChristianaCare classes that we offer to new moms. So talk about what classes we should be thinking about, what we should be taking, and what specifically your team offers.
So it's a list of classes. So being a parent is not just one day you're a parent, but there's a lot of learning that goes ahead of it. So we have the traditional Lamaze classes, if you will, in terms of approaching a baby. We have sort of an accelerated if you're a second-time mom and just want a refreshing course. We have courses around breastfeeding, knowing the decision to breastfeed starts long before you come to our hospital and how to be successful in that from that perspective. And then we have classes for grandparents, CPR, and then others. So it's really a whole library of courses. And again, a number of those are online as well. Just to go back to sort of the idea of radical convenience, the other part of that is we've done a lot with texting people in terms of support with their blood pressure, their diabetes, and supporting them postpartum in terms of breastfeeding. So we recognize just because you're no longer in our four walls, we need to be able to help and work with you through those challenges as well.
Absolutely. And if you are a new mom or soon to be mom and you're watching this and wondering about those classes, you can find those links to the classes as well as the other information in the comments below this video here on Facebook. So Dr. Hoffman, a new mom may be watching this and wondering, you know, I'm a few weeks out from my glucose test, or, you know, I have a friend who had, you know, preeclampsia or any of those things. How can I prevent them? So what is your advice to staying as healthy as you can during this first half of being pregnant?
Yeah, so one of the interesting things is we're now learning that the first half of pregnancy is probably, if not as important, if not more important than the second half of pregnancy. So pregnancy starts with a really solid foundation, and that means a healthy placenta. So the placenta is forming, obviously from the moment of conception, but a lot of the important parts of the placenta and its blood flow happens actually between 8 and 16 weeks. So there are some things that can really help with that. One of which is exercise. So we know that moms who exercise are less likely to have preeclampsia. Again, preeclampsia is a significant problem, and actually now the driver of much of our preterm birth in this country. There's now been recommendations about women who have certain risk factors to take baby aspirin. So baby aspirin has been studied now for over 30 years. We've done a very large trial as well. And what we see is moms who take baby aspirin have a significantly lower risk of preeclampsia, particularly early preeclampsia. Also, small babies or growth restricted babies is another common reason that we're having to deliver them. And it's really, again, a challenge where the placenta is running out of steam, if you will. So aspirin starting at about 13 weeks is super important. And then finally, it also seems to prevent preterm birth. The positives are on that side in terms of negatives. We have not really seen negatives from that perspective. Nonetheless, this is a discussion between you and your provider, recognizing that tallying up the risk factors and then having the conversation, it's the right choice. But for about 40% of our moms, probably ought to be considering being on baby aspirin. The other part of it is healthy eating. We know that moms who eat healthy are less likely to have some of those complications as well.
Fantastic. Thank you for that information. We do have a few questions coming in. So Kathy asks, my daughter is looking to get pregnant for the first time. She's 39. Is she considered high risk, and should she wait for the COVID vaccine?
So two components to that. You know, we know that there are some increased risks with being an older mom. Nonetheless, we have ways of assessing them. So we know that moms over 35 have a slightly higher risk of having Down syndrome as a complication. Nonetheless, just to state that the vast majority, 99% of moms will have a chromosomally normal child. So people start to worry about those risks. But it's important to recognize the glass is 99% full, not 1% empty from that perspective. One of the questions that we're getting a lot of questions about is the COVID vaccine in terms of does it interfere with fertility? This was a internet rumor that had been started because there's a protein that looks vaguely like the placenta protein, which is used as part of the immunization process. It looks vaguely like it. It does not look like it in any significant way. And there's absolutely no data that it causes infertility. In fact, what we do know for sure is that moms who get the COVID vaccine pass on those antibodies to their children. And we have seen significant numbers of COVID positive moms who we've had to deliver or care for in our ICUs. So we are strongly encouraging folks to think about the vaccine, see if it's the right choice. One of the questions that comes up with this is, how do we have so much data so early about the vaccine? And this applies to both pre-pregnancy as well as pregnancy. So just as a reminder, 130 million plus Americans have been immunized with the vaccines. And as part of that, there's a program called VSafe, where we're able to track and follow those moms. And there's been over 35,000 pregnancies that have been followed through that program. And what we see is no differences in terms of birth outcomes. So, we'd obviously like more data, but the data that we have now is very convincing in terms of both safety as well as preventing COVID. And then the last part of it is, we've unfortunately had the opportunity to care for about 400 COVID positive mothers here over the last year and a half. So we know COVID is a really significant threat to pregnancy. And pregnancy is also a condition, unfortunately, where people's immune systems are a little bit weaker. So as we talk about vulnerable populations, as people talk about older folks, people who are overweight or certain medical conditions, unfortunately, within the middle of that, pregnancy sits squarely as a significant risk factor.
While we're on that topic, can you touch on breastfeeding and the vaccine?
Yeah, so breastfeeding is great from preventing infections. Part of it is not just the components of human milk that help in terms of brain development, helping preventing obesity in children, helping prevent diabetes, help lowering the breast cancer risk in mothers, which is a very significant. But all of the antibodies that the mom makes are then passed on to the baby. So we know that breast milk helps prevent a lot of those early infections. COVID being one of them, we know that those antibodies can be found in breast milk. But also to say that, if you look at the other common childhood illnesses, we know that breastfeeding helps prevent them. RSV is a significant challenge, as well as whooping cough. So one of the reasons why we talk about vaccination for pertussis or whooping cough in pregnancy is to prevent that. Unfortunately, children take a little while to build their own immune system. So mom who is nursing helps provide that for particularly the first 6 months of life.
Thank you. And we do have one more question. Jessica asks, what are you doing to make sure women's concerns are heard at all points of pregnancy, labor, and delivery? What are you doing to make sure providers are communicating adequately to patients? Important question there.
Yeah, no, I mean, this is a continual area where we continue to work on. So there are a number of different components about that. One of which is we certainly encourage doulas. So for folks who would like the adjunctive support of doulas, we are very supportive of that. We work both well within community doulas as well as are working on a doula program to help support some of our communities. Similarly, in terms of within labor and delivery, our nurses are doing bedside shift reports. So they're talking about patients and their progress with their families in the room from that perspective. And again, our providers are constantly being reminded about the importance of listening to parents. Our goal is always shared decision-making, to have conversations, to talk to patients about what are the potential options that they have in terms of choices that they want to make, and then continuing revisiting them as their labor course goes through. There are a lot of good choices within labor and delivery. There are also some choices that we would have challenges with, but having that conversation, and again, the ideal time is as part of the prenatal care.
Thank you. Our next question comes from Brian. He asks, you say a vaccinated mother would pass those antibodies to her baby, but wouldn't you only have antibodies if you've actually been infected with COVID and not just given a vaccine?
Yeah. So the vaccine also, the way that it works is to create antibodies. There's been some interesting literature suggesting that the vaccine is actually more effective than having COVID. Although we've vaccinated 130 million people, we know significant members of our community have had COVID. And the literature so far seems to support that even amongst COVID folks who've had COVID, that there is advantage to, in fact, getting the vaccine.
From an antibody perspective, you mean?
Yes. And they make similar antibodies, but it's really the level of the antibody response. I think we're all sort of concerned in terms of what's going on with the Delta variant. We, as similar to most health systems in the nation, are now seeing our fourth wave of COVID. Fortunately, we live in a community with higher vaccination rates, so it's not as severe as we're seeing in other states such as Florida, Louisiana, but we clearly are starting to see an uptick again.
So what would you say to any pregnant woman watching this right now who's worried about protecting herself and her baby from COVID?
Yeah, so I think it's super important to have a conversation. Again, we want to respect people and the decisions that they make, but we also want to provide them with the best information. So what we know so far is that COVID is particularly challenging to mothers. We certainly have had our fair share of moms who've been in the ICU with significant respiratory illness. We know that it's highly contagious, and for most women, it is to their advantage to get vaccinated. We also share the safety information that you and I have talked about in terms of what we know. I will say we're continuing to learn, continuing to seek out that information. There is currently a trial of pregnant women getting the vaccine, which is ongoing, which is recruiting well. So we hope to have more information. But what I can say today is for most women, the risk of COVID is far outweighs the risk that may or may not be with the vaccine. We've not seen significant challenges in pregnant women getting the vaccine beyond the normal side effects that everybody gets with the vaccine.
And wearing a mask is certainly something everyone should remember to be doing, especially in inside or crowded locations.
Absolutely. Again, when folks come in here, even though our staff is vaccinated, we continue to wear masks, recognizing that that's an important part of the care that we give and the way that we show that we care for our community.
Thank you. And thank you all for your questions. Dr. Hoffman, before I let you go, if someone is considering coming to ChristianaCare for OBGYN care, but maybe on the fence, maybe looking at other options, give me that elevator pitch to get them to come to ChristianaCare.
Yeah, no, I mean, I think, one of the things that we are unique is that we are a very experienced center. We have the experts that people need. So whether it be complex cardiac defects, taking care of diabetes, we have the experience and the tools to take care of moms who are completely healthy to moms who have significant challenges. So having that expertise embedded from that perspective, but we also listen to our parents. So one of our key philosophies is to make sure that we are hearing. We know that folks have different choices, different thoughts. We want to be able to accommodate them. I've done a lot of work, and part of it too is making sure that we're hearing folks' voices and collaborating with them in the birth journey.
Well, thank you so much for joining us today, Dr. Hoffman. And as I mentioned, this is just the first episode of an 8-part series we are launching with Dr. Hoffman and his team. In 2 weeks, look out for some information on breastfeeding. We'll be posting that Facebook event by the end of this week so that you're able to say you're attending and make sure you join us in 2 weeks. As I mentioned at the start of this episode, we're also going to be talking about eating for pregnancy and some other key points that Dr. Hoffman has touched on today. And if you have any topics you'd like us to talk about, please submit those in the comments below. We'd love to hear from you and make sure that we are talking about what you think is important as we all go through this pregnancy journey together. Thank you so much and have a great afternoon.